Now we are going to start the second episode, which is entitled as Aim and Necessity of Glycemic Control During Pregnancy. In this episode, we have Dr. Shamsad Jahan Sheli as our speaker. She is the professor and head of the department at the Department of Obstetrics and Gynecology at Burdam General Hospital 2 and Ibrahim Medical College. Madam, would you like to give a small introduction regarding your topic?
Thank you, Dr. Naushaba. Gestational diabetes mellitus is associated with an increased risk of perinatal morbidity and mortality and is a major public health problem. The prevalence of gestational diabetes mellitus is increased in recent decades in patients with older age at conception and westernized lifestyle. Globally, gestational diabetes mellitus is estimated to affect 13.9% of all pregnancy. Gestational diabetes mellitus is associated with heart disease and type 2 diabetes mellitus in later life who is pregnant and diabetes during pregnancy. The children of pregnant women with diabetes mellitus are more likely to suffer from pediatric cardiovascular diseases and problems of metabolic disorders in later life.
Madam, can you tell us how can a pregnant woman with risk factors can prevent development of gestational diabetes mellitus?
Thank you. Lifestyle changes may help prevent gestational diabetes mellitus or reduce its impact. Losing weight before pregnancy, setting a weight gain during pregnancy, eating high fiber and low fat foods, regular exercise. The patient who is smoker should give up smoking. This can reduce the incidence of diabetes mellitus during pregnancy.
Madam, can you please tell us what are the symptoms of prediabetes in pregnancy?
Thank you, Dr. Naushaba. Symptoms of prediabetes mellitus in pregnancy is not always present. If present, patient may notice that she had thirstier than usual. She always feels that she is always thirsty. Blurred vision, nausea, vomiting, and vision may be blurred, more tired than usual.
Madam, can you tell us how can one suspect that she is suffering from gestational diabetes mellitus without doing any investigation?
Thank you, Dr. Naushaba. In many cases, the patient cannot notice that she is suffering from gestational diabetes mellitus. However, few women may notice that she is suffering from diabetes mellitus by seeing subtle signs and symptoms of gestational diabetes mellitus, like increased thirst. She feels that she is taking more drinking water, increased micturition, blurred vision, nausea, vomiting, and infection like yeast infections, etc.
Madam, can you tell us how a mother can prevent development of gestational diabetes mellitus?
Thank you, Dr. Naushaba. Certain risk factors cannot be preventable during pregnancy to prevent gestational diabetes mellitus, but in some cases it can be prevented. If patient is overweight before pregnancy, if she smokes, she can stop smoke, and nutritious by taking nutritious diet and exercising regularly, like 30 minutes walking a day, 5 days in a week. Blood pressure and cholesterol within control limit. Medication like metformin can be given those patients who are obese and have potentially diabetic. That means she may develop diabetes during her pregnancy. So this can help to prevent gestational diabetes during her pregnancy period.
Madam, can you please share your knowledge regarding the ideal fasting and postprandial blood glucose level in a patient with gestational diabetes mellitus?
Thank you, Dr. Naushaba. During pregnancy, blood sugar should be meticulously controlled to avoid perinatal morbidity and mortality and maternal morbidity and mortality. So, whatever the diabetes type 1 diabetes, type 2 diabetes or gestational diabetes mellitus, blood sugar should be well controlled. We usually keep our patient's blood sugar, fasting blood sugar, like less than 95 milligram per deciliter, that is 5.4 millimole per liter. 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner, we call it postprandial blood sugar. That should be the level of less than 120 milligram per deciliter, that is 6.7 millimole per liter.
Sir, would you like to say a few words about the second episode?
So, the speaker has elaborated in detail about the aims and necessity of control of diabetes during pregnancy, particularly in case of GDM. As you all know that GDM affects both the mother and the fetus. So, the aim of GDM control or treatment is to achieve as near as possible a euglycemic status for the mother, and this will have beneficial effect for both the mother and the fetus. So, she has elaborated in details about the procedures, the aim and objectives of diabetes control in patients with GDM to obtain an optimum result for the mother and the fetus. I think it should be carefully listened, the observations she has made, and in our day-to-day management of diabetes, we should keep our always on eye on how efficiently we can control the diabetes. In this connection, I think self-control of diabetes is quite important. That means the patients, every patient nowadays should be advised to have a glucometer, and I think most of them will be able to afford it, so that she by herself can control and adjust her insulin requirement according to the requirements, rather than not going to the hospital very frequently. So, I think this part of the lecture is very important.
Now we are concluding the second episode, which is the aim and necessity of glycemic control during pregnancy. Our speaker, Professor Shamshad Jahan Sheli, has briefly and specifically enlightened us regarding the aim and necessity. Thank you, madam, for sharing your knowledge. Podcast gives us the freedom to listen to what we want and when we want and how we want. Practitioners can tune in on their preferable time, as their time is limited. In addition, multitasking and podcast can also go together, as podcasts are easy to listen to while practitioner is doing other things. Gestational diabetes mellitus is a very common concept and is easily understandable for all. As the global rate is going up in case of gestational diabetes mellitus, it is becoming one of the leading causes of maternal and neonatal morbidity and mortality. Listening to Bexidoc Talk podcast, Obs and Gynae, about gestational diabetes mellitus will gain a new perspective. With this hope, I am Dr. Naushaba Tarannum Mahatab signing off.